From low rates of efficacy to concerns over blood clots, many coronavirus vaccines are facing setbacks. Do the benefits outweigh the risks, or should governments rethink their vaccine rollouts? This is Inside Story. Hello and welcome to the program. I'm Dareen Abughaida. China has positioned itself as a leader in the development of coronavirus vaccines. It's distributing millions of shots to dozens of countries, mainly in the developing world. But its top health official now says its domestically produced jabs have low rates of protection. And that's a rare admission by the head of the Chinese Center for Disease Control and Prevention. Gao Fu said his country is considering options to boost the effectiveness of doses, including mixing different brands. Now, China has produced 4 COVID-19 vaccines, and some trials suggest efficacy is as low as 50%. The maker of the Sidra jabs is recommending longer intervals between 2 doses to improve its impact. And its spokesman says several factors determine how weak or strong a shot is.
The protection rate of the vaccine is affected by many factors, such as the intensity of the local outbreak, the vaccine immunization program, different virus strains, the criteria for determining the case, the age range of patients under observation, and so on. This is one of the reasons for the different protection rate of Sinovac's COVID-19 vaccine in different countries.
The major side effects of some COVID-19 vaccines have slowed down vaccination drives. U.S. regulators have recommended a pause in administering Johnson & Johnson shots because of reports of blood clots. The vaccine is also under investigation in Europe. AstraZeneca's COVID-19 vaccine is being investigated by European regulators for possible links to blood clots. It's been suspended in more than a dozen countries. And some research found the coronavirus variant discovered in South Africa can penetrate Pfizer-BioNTech's COVID-19 vaccine to some extent. And a new study in the U.S. suggests that Moderna's vaccine might have more side effects than Pfizer's. Well, the vaccines differ in the way they trigger people's bodies to fight coronavirus. China's Sinovac uses killed parts of a virus to expose immune systems to it without risking a serious response. Pfizer and Moderna are so-called mRNA vaccines in which part of the coronavirus's genetic code is injected into the body. The UK's AstraZeneca vaccine has modified a version of a common cold virus from chimpanzees to contain genetic material shared by the coronavirus. Then there's the Johnson & Johnson vaccine, which also contains cold viruses that deliver the genetic blueprint of the coronavirus spike protein to body cells. It's the first to be administered in one shot. Let's bring in our guests. In Doha is Patrick Tang, who's the Division Chief of Microbiology at Sidra Medicine. In Johannesburg, Regina Osi, who's the medical doctor and infectious diseases specialist at the Aram Institute. And in Barcelona is Jeffrey Lazarus, who's the head of Health Systems Research Group at Barcelona Institute for Global Health. Welcome to the program. Thanks for speaking to us on Al Jazeera. Regina, so this is a rare admission of weakness by China. What do you read into it?
Well, I think it's very difficult to understand exactly what it is that they're talking about because we haven't actually seen the data. I think the data has been submitted to the WHO's expert group on vaccines called SAGE, and we are waiting for a decision to be pending. But we also don't know what post-vaccine or post-rollout information that China has that may not be part of the initial clinical trial. So it's really difficult to understand when they say, it may not be as efficacious. All we know is that we've been given a figure of about 79% efficacy at the time a while ago, and we don't know what exactly the figures are now. And it'd be really great to actually see these data and to understand better what it is that we are dealing with.
Jeffrey, the Chinese companies, as Regina was just saying, have not publicly published peer-reviewed data on the final stage of clinical trial research into the vaccines, and they've been criticized, in fact, in the past for the lack of transparency. So could the lack of transparency and now this hamper the vaccine's credibility?
I think it absolutely will hamper the vaccine's credibility. We saw the same thing happen with Pfizer and Moderna when they released their preliminary efficacy figures in press releases. It's important to get this into the peer-reviewed journals to make all the data freely available and transparent so it can be well analyzed. And the Chinese have not done that. And we heard originally a much higher figure than what we're hearing now. So that definitely brings into question the credibility of the vaccine.
Patrick, the Chinese official who spoke did seem to backtrack a day later when he said that he was speaking about the effectiveness rates for vaccines in the world and not particularly about China. And he said, this is all a misunderstanding. I mean, do you think officials in China are now concerned that this may have an impact on China's vaccination program because it's aiming to inoculate, it says, 40% of its population by the end of June?
Well, I think this is a complicated issue, and there's many things that we might be able to read from that message. So I think one of it is that, there is a call from those officials that we need to develop the same mRNA technologies in China. I think that's what they're trying to say to their scientists there, that this is a good technology and we need to adopt this in China. They may have overstated the lack of efficacy or reduced efficacy of the other vaccines, including their own. So as the other speakers had alluded to before, the data is still coming out. Every week there's new studies coming out looking at the real-world efficacies of the existing vaccines against the new variants.
Regina, the official also listed two options to solve the problem. He said this: one is to increase the number of doses or adjust the dosage or interval between shots. The other is to mix vaccines developed from different technologies. Let's break those down and look at the first option. What do you make of the first one, increasing the number of doses or adjusting the dosage or interval between two shots?
I think that, a strategy where you provide the basically antigen several times for the body to be able to develop an immunity to it definitely is something that has been used in vaccine development. But again, it is very unclear to me how exactly that would work because we don't know what the original data shows, what the post sort of rollout data is showing now, and whether, this would be a strategy that they could retain in terms of adding a booster with the same vaccine to the existing people who've already been vaccinated.
Right. So, and on the other note, on the other point that he raised, Jeffrey, is mixing vaccines a strategy that should be considered to boost their effectiveness? We've also been hearing that researchers over in the UK are studying a possible combination of Pfizer-BioNTech and the AstraZeneca vaccine.
So I think all three of those options that are being considered are important. What needs to be done, though, is they need to be studied more carefully. If you're going to increase the interval, if you're going to add a second, or in this case, a third jab, if you're going to combine different vaccines and even different vaccines of different technologies, it needs to be well studied. And what we're seeing with the Chinese study is that although 60 countries, the Chinese vaccine, although 60 countries have approved it, we haven't even had the data publicly available or published in the peer-reviewed literature, and that's what's really concerning.
Yeah, and on that note, Jeffrey, Brazilian trials of the Sinovac vaccine showed an efficacy rate of around 50%. And if you compare that to the trials we saw in Turkey and Indonesia of the same vaccine, those stood at between 91 and 65%. How do you explain the varying level of effectiveness?
Well, again, without all the details, we can only speculate. We can wonder if it has to deal, if it's related to the variant, the different mutations of the virus. We know that the Brazilian variant has been, more transmissible. And then it can also bring into question about how the trial was run and details around the clinical trials. I can't really speculate, but it does concern me when we see 50.4% in Brazil and I think 83% in Turkey. That's a very wide range. It's not unusual to have different numbers or different rates in different settings, but we need to understand why. That's what we're lacking. So we're really just flying blind right now.
And, we always speak about, and the companies and the government speak about this efficacy rate, Patrick. If you look at Pfizer and BioNTech and Moderna vaccines, they claim to have an efficacy rate of 97% and 94%. I just wonder if you can really break it down for us in the simplest terms and tell us what efficacy actually means and how it's measured.
The level of protection that you get from the vaccine. So that compares the number of people that get infected in a group that's been vaccinated and the number of people that get infected in a group that has not been vaccinated. And when you take the ratio of that, you can come up with a vaccine efficacy. So the studies, what you're quoting, are some of the original studies before the emergence of the variant and in regions where these new variants were not prevalent yet. So these high efficacy numbers would apply to the original strains of SARS-CoV-2. And that may not apply to the newer variants, such as the one from South Africa, the one from Brazil.
Yeah, we're going to look at the variants in just a second, but Regina, let me ask you this. How concerned should we be about the efficacy rates of a vaccine when a person, if they have a choice, goes to choose what type of vaccine they should take? Is efficacy the major factor that they should be looking at?
Well, I think the efficacy is what we try to do to compare apples to apples, basically. But one thing that is very important, and I think what we shouldn't forget, is that most of these vaccines, at least the ones we have data on, actually prevent severe disease mortality from coronavirus almost by 200%. So there are few escape illnesses, but people mostly have mild and moderate disease and therefore do not overburden the health systems, and actually the mortality is reduced. And I think that that's something that we have to keep in mind. And if you look at all of the vaccines that are currently sort of been tracked in the Western world, and you look at the real life scenarios of these vaccines, very few people would have died or have had a very severe case of coronavirus after being fully vaccinated. Of course, we're going to see a little bit more of that as we go on and vaccinate millions and millions of people. But I think we shouldn't forget that these vaccines have two roles. One is preventing the disease occurrence first and foremost, and of course, preventing transmission. But the second role is also seeing whether we can have a decrease in the severity of cases that do develop once you've been vaccinated. And I think if we get that second point right, and these vaccines definitely do that, then I think that we have already a leg up in terms of fighting the pandemic. And making sure that, especially in...
Yeah, go ahead. Complete your thought.
Go ahead. No, I was just going to say, in places like South Africa, where the health system is relatively constrained, it really helps us.
But will governments be rethinking their vaccine rollouts, Regina, considering that now you have the claim from the Chinese that their vaccine is not as effective as originally thought? And also, just earlier today, we heard that Johnson & Johnson is being put on pause.
Well, I think it's a matter of looking at the risk-benefit scenarios in each case, right? I think for the Chinese vaccine, it would be helpful if governments could actually get information that they can base their decisions on and have clear, transparent data that we can look at and make a recommendation. And for the other vaccine, for Johnson & Johnson, it's being paused in the U.S. because of a few cases of thrombotic events. And I think that it is important to always watch the side effect profile. But when you look at the grand scheme of things in terms of what coronavirus has done and the havoc that is wreaked on different economies and different, especially in South Africa, for example, I think that it is very important to weigh that risk benefit very carefully. And I wouldn't just throw out the vaccines because of these few hurdles that have come up. I think we have to keep in mind that we want to keep people healthy. We want to keep people out of hospitals. And if we can make coronavirus or COVID-19 become more of a mild disease like a regular flu or something like that doesn't cause mortality, I think that that's something that we definitely have to keep in mind.
Jeffrey, companies and governments say that the short-term safety data looks good because that is what we do have data on. But there is questions and concerns surrounding the long-term safety and the long-term effects of the vaccines, of which we just don't know.
I'm not as concerned about that. I mean, we have very strong, very robust short-term safety data, and then it's a question of what is long-term. I mean, the vaccines like AstraZeneca and Johnson & Johnson's are based on a technology that's well known and has been proven to be safe in the long term. And we have to remember that even if the mRNA, the Pfizer and Moderna vaccines haven't been used in humans before the trials in 2020, they've been under development for over a decade. So they're not totally unknown to us, and they're expected in many ways to be an even cleaner and safer vaccine than the others. And then just going back to what Regina said, in terms of Johnson & Johnson, we're seeing right now one reported case of blood clots per million. So again, when you weigh up the risk benefit and you look at the havoc that the coronavirus, COVID-19 is causing on the economy, health, and the health system, it wouldn't surprise me if it does get approval the same way AstraZeneca did after additional regulatory scrutiny in the European Union.
Yeah, on that point you raised, Jeffrey, Patrick, I'll come over to you. This mRNA technology that's being used in Moderna and Pfizer. Just as Jeffrey just said, this is the first vaccine of this technology to be used on humans. How can we be assured of its long-term safety?
Well, I think long-term safety is not something we're that worried about. It's the short-term safety that people have been up in arms over recently, right, with the blood clots and other sort of side effects that have been reported. But we do have a robust system for monitoring vaccine side effects in the long term. When vaccines go into this stage, what we call like phase 4 of the rollout, doctors do report any unusual side effects in people that are vaccinated. So it's not something that we're really worried about. I think we should be more worried about are the long-term side effects of COVID-19 infection. And I think when we disproportionately put too much emphasis on side effects from vaccine versus the very real and very more severe side effects from COVID-19, I think the two things have to be weighed one against the other.
Regina, what can you tell us about boosters? Because now we know that Moderna is trialing a booster to protect against what's known as the South African variant. How worrying are these variants, and how much work is going to have to be done on these vaccines going forward to protect against these variants?
Well, I think the advantage of having these platforms is that we know now how they function. And, Moderna and Pfizer-BioNTech have actually developed vaccines based on the mRNA platform, and they can tweak them based on what's circulating. And we do know that the coronavirus is probably going to be circulating for quite a while yet and will develop new strains that might be concerning. So I do think it's completely reasonable for vaccine developers to continue looking around and seeing whether they can add a little bit more function in terms of what are the different properties of the circulating variants that might not be as responsive to the vaccines. So I do think that that's a welcome development. Boosting has always been a strategy that's been used in vaccines for the longest time. And therefore, it's something that we know sometimes work, where you prime your immune system and then you provide a second dose or third dose or fourth dose to make sure that as many antibodies or T cells are produced as are necessary to fight off the infection. So I do think that it's a welcome development, and we're going to have to continue looking, and we're going to have to continue working as we try to beat this pandemic. We're going to have to adapt as the virus adapts.
Yeah, Jeffrey, it's not only Moderna. In fact, it's also Pfizer and BioNTech. They said that they were testing a third dose of the vaccine to better understand the immune response against new variants. How do you see this playing out?
I think that's great news, and it makes perfect sense. As we've seen with the variants of concern as well, that we're going to need to be thinking in the long run. I mean, the first goal is to get, some kind of global herd immunity. We're far from that, but at the same time, we need to be looking at the different mutations, looking at the variants of concern, and seeing, do we need that third jab? Do we need a booster? Do we need to rejig the vaccine itself so that maybe the Moderna or Pfizer or other vaccines will actually just be different in half a year's time and more responsive to the variants that we've already identified?
On the issue of herd immunity, Patrick, we only have a few months' worth of data when it comes to immunity duration. So what is the risk that if immunity declines before that herd immunity is actually achieved, then vaccinated people will just become susceptible to infection again, and these rollouts might fail?
The preliminary data from people that have had vaccines like the Pfizer vaccine are that it's as good at 6 months, and it's probably going to last even longer than that as more and more people have had the vaccine for longer and longer periods of time. And from what we know about other vaccines, we should expect a longer duration of protection. And in the worst case, we could come up with third doses, as the previous speakers had talked about. But I think the one point that's missing is that we need to reframe some of all of this. All these fears about whether the vaccine is going to be less efficacious at 6 months, whether it's going to work against the variants or not. I think we have to focus on the real task at hand, which is to vaccinate everybody, as many people as possible, in as many countries as possible. I think we can't lose sight of that main goal. And we can't be diverted into thinking about third doses, new variant vaccines, other things like that. That research is definitely going to go on, but we can't lose focus of the goal.
How do you explain, though, Patrick, that over in the U.S., one of the latest poll that I was reading, this is according to Gallup, it was saying that some 26% of Americans say that they wouldn't get a vaccine right now. So there's real vaccine hesitancy and vaccine refusal. Why do you think that is?
Well, that's a very complicated issue that would take a long time to discuss. And you know, part of it is the communication, how the communications have rolled out. Part of it is politics. Part of it is leadership. There's so many facets to vaccine hesitancy. But the thing is,
but
no
also some also say it's also the flip-flopping. For example, AstraZeneca's image has kind of been shattered in a way right now because of the reported blood clots, and you know, now we see this with Johnson & Johnson. So this flip-flopping doesn't really help people out, does it?
Well, I think it's too much information and too much emphasis on certain parts of the information, and where people lose sight of the overall benefits of the vaccine. These are exceedingly rare complications, and we think about other things that we take all the time. So birth control pills cause blood clots all the time. COVID-19 definitely causes blood clots. If people are worried about blood clots, they should not get COVID-19 because that will definitely give you blood clots.
Right.
So I think we have to reframe all of this instead of just focusing on these very rare kinds of occurrences.
Jeffrey, Patrick was just mentioning the messaging a moment ago. I mean, how do you explain the different interpretations when it comes to, let's look at AstraZeneca, for example, the concern over possible link to blood clots. To date, 4 European countries have stopped using AstraZeneca vaccine, such as Denmark and the Netherlands, while others, like Germany, like France, Spain, where you are, have put an age restriction on these shots. So how do the different countries and bodies actually come up with their conclusions?
Well, firstly, I would say, I think in line with what Patrick was saying, is suddenly we need to reframe things. Suddenly there's more of a fear of the vaccine than of the virus in some settings. So we need to turn that around again and remind people that COVID-19 can be a very serious infection and potentially life-threatening. So in terms of how the different countries have taken their decisions, hopefully they've applied some kind of risk-benefit analysis. But like you said, the flip-flopping is what confuses people. And I think some of those decisions have been taken rather hastily. So we've seen a country like Spain, you know, limit after the EMA decision, AstraZeneca to 60 to 64-year-olds. Then the next day they expanded to 60 to 69-year-olds, and it hasn't even been clear if people will get their second booster with AstraZeneca or not. So as the different countries react differently to the EMA decision, it creates confusion among the public. I think that, you know, given that the European Medicines Agency has said that this is a safe vaccine, that if Europeans aren't going to use the AstraZeneca vaccine, they can finish off the second doses, maybe restrict it, but really, you know, give it to COVAX, give it to the rest of the world, because we do need to create that global herd immunity. And there's a lack of vaccine doses in almost all countries of the world, and Europe is lucky enough to have different options with Pfizer, Moderna available.
Right. Regina, last word to you. I mean, what is your opinion on the extent to which stereotypes and geopolitics play a role into the acceptance of a certain vaccine? In 30 seconds, if you don't mind.
Yes, I think that, you know, the communication is very difficult, as you've mentioned. I think it's very important to keep focus on the main message. We do not want to get COVID-19. We want to stop the pandemic. We want to go back to life as usual if we can do that. And one way of doing that is getting vaccinated. And I think we have to really go back on focusing on that.
Thank you so much. Very interesting to talk to all of you. Patrick Tang, Regina Osi, and Jeffrey Lazarus. Appreciate your time. Thanks for watching. You can see the program again anytime by visiting our website, aljazeera.com. For further discussion, you can go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is AJ Inside Story. From myself and the whole team here in Doha, thanks very much for watching, and goodbye for now.